Let's get started on irritable bowel syndrome. IBS manifests from a functional disorder of the bowel. Neuroendocrine changes may cause motility issues within the intestines. However, there is no inflammation or tissue changes in the intestinal mucosa.
Clinical manifestations may include pain in the abdomen, change in bowel habits, constipation, diarrhea, inability to empty bowels, indigestion, nausea, excessive amounts of gas, and urgent need to defecate. The manifestations of IBS are intermittent and may occur for years. Patients often report a history of GI infections and food intolerance.
There are gender differences with IBS. Men are more likely to have IBS with diarrhea, they are less likely to admit symptoms or seek treatment, and they experience more interpersonal difficulties. On the other hand, women are affected 2 to 2.5 times more often than men. They are more likely to have IBS with constipation, and there are more reports of extraintestinal comorbidities in women.
No single intervention is effective for all patients with IBS, and because the patient is not usually hospitalized, interventions focus on teaching. Teach the patient to follow a low FODMAP diet, incorporate regular exercise, drink 8 to 10 glasses of water, and implement relaxation. Monitor the weight, diet, and bowel elimination pattern and frequency.
IBS is diagnosed solely on symptoms. The Rome 3 criteria for diagnosing IBS require the presence of abdominal pain and or more discomfort for at least 3 months that is associated with 2 or more of the following: improvement with defecation, change in stool frequency at onset, or change in stool appearance at onset. A thorough history and physical exam is the key to an accurate diagnosis. Drug therapy is not a one-size-fits-all kind of thing. It is very individualized. Antispasmodic medications decrease GI motility and smooth muscle spasms, reducing pain and diarrhea, such as dicyclomine. Loperamide, also known as Imodium, is a synthetic opioid that slows the intestinal transit. This is another option for diarrhea. Also, low doses of tricyclic antidepressants and SSRIs may reduce these symptoms.
Complications of IBS. It can cause dehydration, malnourishment, food intolerance, hemorrhoids, depression, and anxiety. However, the biggest concern is that it can hinder the patient's quality of life. If you are experiencing any of these symptoms, please schedule an appointment with your primary care physician to discuss your treatment options.